This bill is like, no, this is not right. There will be no lifetime bans on insurance coverage. When in 2014, that ban will extend to annual coverage, so they will no longer be able to say, well, we will only pay for services that you provide in up to a cap in a year's time. I mentioned preventative care for Medicare plans, but also for new plans. I think, dare I say it, one of the flaws perhaps in this bill, and no legislation is perfect, is that we didn't extend that to all existing plans, but I'm sure that in the coming years we will get that on there. What do you do if you do not have coverage now? We provided a bridge into a high-risk pool for individuals who have been uninsured for at least 6 months. They will be able to go into to the state if their state has chosen to provide that services, and if the state has not chosen to provide it, we had a provision in there that would allow the Secretary of Health and Human Services to go in and set up a state pool so persons who are uninsured can access that. Community health centers, for the first time, that safety net we know as community health centers, we provided $11 billion in mandatory funding for them. What we also did was ban women tend to get charged 3 to 4 times the premium of men, simply because of your gender. What you may not know, thanks to Congressman Richardson and members of the CDC, for the first time ever, we included non-discrimination provisions, civil rights legislation that has been extended to the health reform for the first time in history. So whether it's gender, race, color, you name it, individuals will no longer be able to discriminate based on those things. Quickly, 2 things, and I'll wrap up. Rate review and comparative effectiveness, which Congresswoman Christensen spoke about. Why is that important? Health disparities. We all know that there's a terrible problem with health disparities in our communities, and this provision was included in the bill, as was provision for rural areas, and I won't forget, because thank you to Congresswoman Christensen as well, the Office of Minority Health was codified in this law. And what that means is for the 7 sub-agencies under the Department of Health and Human Services, they will now have offices of minority health. And that's thanks to all of the hard work that we, the Congressional Black Caucus, Congresswoman Christensen and Congresswoman Scott did. And we also, at the same time, elevated the, National Center for Minority Health into an institute. And that's important because of the mandatory funding that they will receive, and just elevating that issue at the Department of Health and Human Services. I'm going to stop now because I'm sure you may have some personal questions that you may want to ask, and certainly I can share a number of stories with you as we debated from start to finish, I think over 9 months, this Affordable Care Act. So if you have any questions at the end, I'll be happy to answer them for you.
Thank you, Barvetta. And next we'll hear from Dr. Georges.
Good morning. I want to thank you, Congresswoman Christensen. I just want you to know from our accents, you may note that we come from the same region. I also come from the U.S. Virgin Islands, but live in New York. I'm pleased that to be part of this discussion. This is a new role for me, being a member of one of the largest social welfare organizations in this world, with 40 million members, an organization called AARP. So for those of you who, I'm not going to ask you to show me your card, but for those of you who are members of AARP, I want you to know we've been very deeply engaged in this whole healthcare reform. And you know that AARP was on the Hill, and we had partners like Dr. Christensen, Congresswoman, I call her Dr. Congresswoman Christensen, who was one of the people on the Congressional Black Caucus who supported, you know, what has happened today. So if you want to think about anything, you can say that the issue of this whole healthcare reform is built into what we in AARP say is our DNA. Just very quickly, and I always say to them, everybody doesn't want to know everything about AARP, but I have to do this spiel about AARP. It was founded by next slide. It was founded by Ethel Percy Andrews, and she was a teacher. And we always talk in the AARP about what has happened over the years with our membership. But it is non-profit. It is nonpartisan. We're in 50 states. We have a state office in the U.S. Virgin Islands. The office is located in St. Croix, Congresswoman Christensen's home. And it's governed by a 22-member voluntary board. I happen to have been elected this year and will be on the board till 2016. My new job, no pay. Next one. And so I want you to know that what we're doing in AARP is really trying to enhance the life of all of us. You know, and people think that AARP is only for old people. Well, I don't consider myself old, and I'm sure you don't either. And so what we're doing is trying to enhance the life of people 50 and over, because we firmly believe that we have a right to age, I would say gracefully, but age with dignity and have appropriate care. And one of the things that we do at AARP is advocate on behalf of our members. So one of the things is we've always been engaged in this healthcare conversation. Dr. Andrus was a woman who fought for people who were downtrodden, people who had retired and were living in poverty and living lives that none of us should have to live. Let's go on. The life transition piece. You know, ordinarily we think of life as you know, you age, you get here, and then you go downhill. But that's not the way we think about it in AARP anymore. We're taking a new look at life and what we should be doing in life transitions in AARP. We think life should look like this, the new view of life. You know, hey, there are medical advances that we should all be able to take part in. In the workplace, some of us continue to work. I'm not telling you my age, but I work every day and will continue to work till I can't do it anymore. So we want to find new ways to engage and deliver to our members what we think they need. And that's why we kept fighting to make sure that this healthcare reform took place. We want a paradigm shift for all Americans. And we think yesterday's norms, forget it, that's past. There's a new way of looking at life. So what's next? You hear what we say in AARP, we're not done yet. So we know that only a third of the people are going to stop working. So they need some relevance, but they also need to be healthy. You know, you can't have a work life if you can't get up in the morning because you're ill. You can't have a good work life if you can't go and get a mammography done, as this act will give. So we know that people need to find a purpose in life. One of the things we talk about in AARP is the boomers. And people say, well, why are you talking about them? Well, I'm sure some of you in this room, if you want to admit it, will be 65 in a very short period of time, and it's going to be the first time in our history we're going to have so many people who will be over 65. And one of the key things that this act does is wellness, prevention, and chronic disease management will be a critical piece of what will happen. And that's what baby boomers and all the rest of us want. We have more data about baby boomers than we do about anybody else because we've learned to collect it over time. So we know that that's what they want. And so what then does this new health care law mean for us, for you as African Americans? Well, it's going to impact all of us, the boomers particularly.